Hi, my name's Diane Keenelands, and I'm the NICHE coordinator at Advocate Lutheran General Hospital, and this is part of the Advocate healthcare system. So we've been a NICHE designated site at Advocate Lutheran General since 2011, and we have GRNs that represent every area of the hospital, and we meet currently every other month, and the GRNs have really become a close-knit group, and they're in their own way kind of exploring their own areas of impacting their units. And one of the areas that we've been trying to impact is restraint use. And we don't have a huge problem with restraint use in our hospital, but it still is an issue. One of the units that has a large use of restraints is the medical intensive care unit. And I'm a previous medical intensive care unit nurse, and I know why they have to have restraints in that unit. And the last GRN meeting, the GRN at the MICU came to me and she said, I know we used restraints too much in our area. And I said, I understand because you guys do have a lot of tubes and drains in your patients and they get confused with delirium. And I know you have to use restraints sometimes. And she said, no, sometimes we don't have to use restraints. And there are times when I go to a patient and I stay with that patient and I spend a few extra minutes with them and get them out of the bed in the chair and talk to them and have talked to the family about what would help them to become more oriented. And it works. And I take the restraints off and I get an order to have the restraints removed and they come off. And the nurses in the unit will come to me and say, are you crazy that you're taking the restraints off that patient? And she said, oftentimes they stay off the patient. And I just want to give the kudos to that nurse and to other nurses with very similar stories in our hospital, these little wins one by one, where we see them impacting both the patients as well as their peers. And it's very hard to be the standalone person in your unit and be the one to do what's right when everyone around you is saying, this is not how our culture always is, and to do what's right for the patient. And I see that happening more and more in our hospital. And I think it's because of the NICHE program and the concepts that we're teaching. So thank you.